This video does not substitute for the professional advice from your doctor or specialist. Please always seek the medical advice from your doctor or specialist regarding any physical condition you may have or medications you take or before taking any lifestyle change. Thank you. Hi, my name is Sean and I'm a 38-year-old married father of 2 young children. I have one very busy and hyper 3.5-year-old boy and a 7-year-old girl. I got PNE or Pudendal Nerve Entrapment, which also goes by the name of Pudendal Neuralgia, 2.5 years ago. My hope in doing this video is to bring awareness, help, change, research, and improvements for everyone with PNE. Many specialists for PNE agree with myself that PNE is a common, painful pelvic medical problem that's misdiagnosed as other conditions, underdiagnosed, and has been ignored for too long. It is hard to be the best parent, the sole income provider, and honestly hard to be the best husband for anybody without any medical problems, disabilities, or chronic pain. When you have PNE, however, these things are even harder, as anybody with PNE would clearly know and understand. Every day is a challenge unlike most have ever encountered. Pain magnifies life's everyday problems and even the unexpected challenges and makes it harder for those with it to function and to work. It is constantly on our minds since we experience it so often in a day at a high level, along with the other side effects such as urinary or bowel problems, sexual problems, and medication side effects that vary from tiredness, fatigue, dizziness, and more depending on the medication and the dosage. So what is the pudendal nerve, PNE, and pudendal neuralgia, some of you might ask? Well, the pudendal nerve is a major nerve that has many branches that weaves throughout your pelvis and affects important sensory, pain, and motor functions in your body, such as urination, sex, and having bowel movements, among others. The worst symptom for most with this is the extreme pain from the nerve that it causes. This is why we really hate PNE, because it gets on our nerves. Pudendal nerve entrapment is a compression from scar tissue, SIJD or sacroiliac joint dysfunction, varices, anatomical abnormalities such as tightness of space of the ligaments where the nerve passes in between them, or other causes somewhere along the path that the pudendal nerve takes. Pudendal neuralgia is pain from the nerve somehow being compressed or irritated, basically. The pudendal nerve in the pelvis is just like any other nerve in the human body, in that it can become compressed, resulting in pain and dysfunction of that nerve, just like in carpal tunnel syndrome or tarsal tunnel syndrome. This compression can be from scar tissue and other causes. The pudendal nerve is the main nerve in the pelvis, which affects a lot of motor and sensory functions or organs in your pelvis and lower abdomen. It can cause pain in the perineum and its branches to many deep and superficial areas of the perineum, such as the perineal branch of the pudendal nerve. There are many branches of this one nerve, which can give different symptoms to patients, but most will have pain sitting. This single nerve also has the dorsal branch, distal Alcock's canal, area close to the dorsal and perineal branch, the Alcock's canal itself, and rectal branches, sacral root area where the pudendal nerve first originates. There are also many causes and areas of compression, so finding the exact cause and entrapment location is important, especially before surgery. The main symptoms of PNE or pudendal neuralgia, depending on the branch of the nerve affected, are the following. Pain in the perineum, which is the area between just above the anus and the genital area. It can be described as a burning, stabbing, knife-like, or other pain, and sometimes numbness. Urinary frequency, urgency, or hesitancy. Erectile dysfunction, constipation, rectal pain, pain while sitting that gets worse the longer you sit and the nerve is compressed. Genital pain, painful sex or pain after sex, hyperarousal, a feeling that causes extreme sexual arousal, which is a bad thing considering that most with PNE cannot have sex or have painful sex. Pain made worse when bending over or heavy lifting. Vestibulitis and possibly pain in the upper thigh area. Some other effects of PNE or pudendal neuralgia are a lot of people over time may have to go on disability and quit their jobs. They're unable to drive much or even drive at all. They're unable to sit upright without a special pillow or special cushion. They're unable to have sex or have sex without pain. It causes stress and dysfunction in marriages and in relationships with their partners. It causes financial stress and hardship from multiple doctor visits and or the loss of job due to disability. It causes depression from the sudden loss of ability to do many normal things the patient used to be able to do prior to this, including those of any age, young and old, who can get this. It causes sometimes pain while sleeping if the compression is severe enough or goes on long enough, or if you have a flare of it can cause a more, sometimes cause a more constant state of pain. It affects relationships with friends because they are no longer able to go out and do very much with their friends. It causes a feeling of loneliness due to isolation from friends or partners because of the debilitating illness. They're unable to play certain sports, physical activities, or exercise anymore because these things make the pain generally worse. Here is a little PNE humor, even though PNE is not something to laugh your butt off at all. Top 10 other ways you know you have PNE. 1, you forgot what the word sex means. 2, you take more meds than all of your grandparents combined. 3, your kids ask if you are a grandpa or a grandma. 4, you like baths more than your young kids do. 5, you'd rather die than wear spandex, Speedos, or even pants. I personally wouldn't wear Speedos even though I have PNE though. Number 6, you see your toilet so much that you give it another name and talk to it. 7, walking up 3 flights of stairs is like climbing Mount Everest. 8, most of the doctors you see or want to see are from another country and have foreign accents. 9, everyone in your family thinks your pain level is at least half the amount it really is. 10, you mention to your new doctor that you have PNE and you get a blank stare in your face. Okay, on a serious note, back to seriousness. Okay, There are many current surgical and non-surgical treatments for PNE, with surgery being the last resort, depending on the cause and location. The non-surgical treatments vary from physical therapy to PRFA, or percutaneous radiofrequency ablation, ESWT, or extracorporeal shockwave therapy, hyperavoidance, which is what I currently do, which is basically avoiding doing anything that makes the pudendal nerve compression worse, such as heavy lifting, walking stairs, running, driving, avoiding using weights that use the pelvis and the lower body parts, and sex. The surgical treatments for this vary depending on the exact location of the entrapment of the nerve. They range from the TG approach, decompression surgery, the TIR approach, decompression surgery, the laparoscopic PNE decompression surgery, which at this time unfortunately is only available in Istanbul, Turkey, with a Dr. Tibet there, who has recently, I believe, tried to train or do some presentation on it here in the U.S., and hoping that he will, continue to, train more doctors here and bring it over here. The anterior pubis ramus approach, PNE decompression surgery, which is only done by 2 surgeons in the world, Dr. Lee Dellin and Dr. Osman. You can see my other videos or go to Dellin.com to see which surgical approach is best for each entrapment location. Keep in mind that surgery is pretty much the last option. You want to try everything else and wait a long time before you try surgery. The current success rates for surgery are not thoroughly published for unknown reasons, but are likely 50% or less for improvements of a good amount. One of the reasons which has been given is the cost involved in doing a thoroughly published, scientifically controlled study. The success rates for all other non-surgical approaches are also unknown, but at this time are not thought to be very high. There is a risk that the PNE can get worse, either with or without surgery currently. I mean, if you have some kind of anatomical problem causing the PNE and then you re-injure it, it can cause either temporary or more permanent worsening of your symptoms. So there's a risk either way, with or without surgery. So you have to weigh both of those. In my opinion, PN and PNE are extremely misdiagnosed and underdiagnosed medical problems that are the root cause of pelvic pain in many people in the world, and are often the cause when doctors cannot figure out what is wrong for sure with the patient who has pudendal neuralgia or pudendal nerve entrapment, despite after doing all tests and ruling everything out. My story is not exactly the same, but very similar to others who have come to have a painful pelvic medical condition called pudendal nerve entrapment. After visiting the ER in 2010 many times, early 2010 in January, and different family practice doctors, urologists, and other specialists, and undergoing many tests I slowly arrived at my diagnosis. At first, I was told it was prostatitis, and later I was finally given the proper diagnosis of pudendal nerve entrapment. Little did I know when I was given this diagnosis what it meant, or what I was actually in for. I thought it would go away very easily, but there was more that I had to learn about PNE, and I realized quickly that there was also more that the medical community, medical profession needed to learn about PNE and its treatment. I'm not even totally sure how I got PNE, which is the case with a lot of other people also. I do know that it started at first as frequent urination, urethral pain. Within 2 weeks, I had sitting pain. And then actually after being on antibiotics for months, which didn't help, my urologist prescribed diazepam, which actually relaxed the pelvic floor muscles and nerves, and actually helped it to all get better. My urinary problems, my pain, everything to get 95% better within several months from treatment with diazepam alone. And finally allowed it to heal. However, big however, then 2 months later, after I thought I was better, and before I was actually officially diagnosed, I had with PNE, I actually had a very small physical trauma caused by simply standing up against the current of the ocean, which made this, when I stood up, I felt this pain down where my adductor muscles are and where my perineum is, and the dorsal perineal branches of the pudendal nerve area. I felt that pain in that area, and a pool, and then this immediately made my pain worse, and all the symptoms come back, urinary symptoms, and it likely began the scar tissue reformation or entrapment of the pudendal nerve by varices or other structural causes. Most with PNE have had some sort of trauma, infection, or surgery cause their PNE. Not all, however, have been lucky enough to at least get the right diagnosis or medication to even help. It can be anywhere from 10 years for some cases, I've heard, before people are actually diagnosed with the correct diagnosis. I think the average being 5 years. Even fewer I have discovered have been able to get surgically cured of this. There are some of the reasons which started my battle. These are some of the reasons which started my battle, my war, to win the fight against this extremely underdiagnosed, misdiagnosed, and undertreated condition, which I am certain affects thousands, if not millions of people in the world without the right diagnosis and treatment. I am positive and hopeful and trust in God that this war will be won for not only myself but for many others now and in the future. This underdiagnosed pelvic condition has gone on way too long without the full attention it deserves from the entire medical community. And now is the time for it to come to their full attention. I believe, along with many other PNE specialists, like I've said, this is a very common chronic pelvic pain medical condition, PNE, throughout the entire world, but it's unfortunately extremely underdiagnosed or misdiagnosed, as I believe some of the major misdiagnoses given are IC, prostatitis, vulvodynia, chronic non-bacterial prostatitis, chronic pelvic pain syndrome, vulvodynia, vestibulitis, prostatinia, idiopathic vulvodynia, idiopathic orchialgia, idiopathic proctalgia, idiopathic penile pain, coccydynia, levator, Anni syndrome, and for those with pain in the ischial tuberosities as ischial bursitis and more. Idiopathic means unknown cause. Some of these are diagnoses which are given to explain a symptom and not the actual root cause. Some of these are actually caused by problems other than the pudendal nerve itself, and testing should be done for these other problems. But once those other problems are ruled out by doctors, then PN and PNE should be considered a possibility. IC, which is among the most common misdiagnoses for PNE, is very difficult in itself to prove and really can only be proven by cystoscopy with hydrodistension, which shows inflammation or sores of the bladder wall. Some who have even had this done are still labeled as having IC. And even with, these people, they may still even have pain in the perineum or other symptoms that point to pudendal neuralgia or PNE. Unless a test is done to absolutely confirm it's IC or other, pudendal neuralgia, pudendal nerve entrapment should be considered as a possibility. It's pretty sad there are more professors and teachers in the world familiar with PE, physical education, than there are for PNE. It is unfortunate that while carpal tunnel syndrome, tarsal tunnel syndrome are widely accepted as diagnoses, that because of the lack of training and education by many doctors, pudendal nerve entrapment and pudendal neuralgia is not as commonly diagnosed or treated. There are millions of people who suffer from pain in their pelvis area and have little, if any, help at all or guidance from any other doctors in their local area on these conditions most of the time. The fact that it is hard to visualize the nerves in the pelvis and the lack of knowledge of some doctors about which tests should be performed to diagnose the exact nerves that are compressed has hindered many patients from getting the proper and correct diagnosis and treatment throughout the entire world. It's time that people with PNE stop being the butt of all jokes. It is really literally a pain in the butt and not a laughing matter. Think about this. There are thousands upon thousands of men who are diagnosed each year with prostatitis. Most cases of prostatitis are not acute prostatitis and are instead chronic. And the majority of chronic prostatitis is not from an infection. Why then are men labeled as having prostatitis when there's nothing wrong with the prostate? It is because of the lack of knowledge for most of the entire medical profession regarding the pudendal nerves and its branches. They're simply not taught about this in medical school or residency most of the time. But they are certainly taught about infectious acute prostatitis, which causes similar symptoms but not all the same exact symptoms. People who have PNE, which mimics prostatitis, do not have a fever or infection. In the beginning, it is possible that there may have been an infection which may have started their scar tissue in the pelvis. That may be possible. However, after 6 months and antibiotics has been taken, it is more likely that they have PNE or PN than prostatitis, especially after a digital rectal exam, prostate secretion is checked, prostate ultrasound is done, cystoscopy is done, and other tests have been performed to rule this out. This has taken many tolls on everyone with PNE, including myself and my family and marriage. The divorce rate for America is around 60% right now, but for marriages that have a person with a chronic medical condition, it is much higher at least 80%. And I have heard of and seen firsthand this happen with others in marriages who have a spouse with PNE. When you factor in all the financial, physical, and emotional effects, it makes sense why this happens. I believe in the vows I took and that marriage is for better or for worse, in sickness and in health, till death do us part. Nevertheless, this is enough to test and challenge marriages with people who have these same convictions like nothing else could. Part of the frustration felt by many with PNE is that our own family members or spouses do not truly understand the extent of what we endure. We all look healthy from the outside. It is only when you truly walk in a person's own shoes and endure what they do that anyone can understand what that person faces each day. We have had to face many challenges and make many sacrifices since I got PNE, as does everyone else who gets PNE. My effects included having to give away our new dog, my ability to go to work going way down, my income level as a sole provider going way down, my expenses, mostly medical, going way up, my ability to be the great father and husband I was prior to PNE was in my opinion also greatly affected, even though I do love and care for my family greatly. This is my typical day, and for most of the past 2.5 years. I wake up with a pain level anywhere from 5 out of 10 or below, depending on the previous day or week's activities and how I manage to sleep that night. What I mean by this is that I usually have to sleep a special way, or else I will face an increase in pain the following morning. I can no longer sleep comfortably on my side as I used to before PNE. If I do sleep on my side, I have to put a pillow between my legs, and even that does not really help much, and in fact I think it increases the chances of making the pain worse. I can only sleep on my back now, but sometimes I roll over in the middle of the night without realizing it, which can make things worse in the morning. After I wake up, I slowly and carefully get out of bed and head straight to my bathroom and to take the slew of medication I require in order to get through the day and function as much as normally as possible with as low of a pain level as I can and without as much urinary problems as I can. I quickly wanted to just mention the medication that myself and many others take to help with the pain and symptoms of PNE, since some doctors and patients still do not know this. The most important medication for most with PNE is diazepam, a muscle relaxer and a muscle spasm inhibitor, because it relaxes the pelvic floor muscles, the fascia, the bladder, the nerves, and it decreases the spasm of all these components, which is crucial in helping with most people's urinary urgency frequency problems associated with this, as well as those who have bowel problems. In fact, diazepam is really the only medication that helps me with my urinary frequency urgency problems, and I have tried other muscle relaxer medications and other medications with no help at all. Dr. Michael Hibner, a leading expert on PNE and a PNE surgeon, also strongly believes in diazepam for many who have PNE. It somehow also seems to help with pain. Tramadol is another great medication for PNE because it is not as strong as some others medications such as Oxycontin, which Oxycontin and other stronger ones are more addictive. Others have to take nortriptyline, amitriptyline, Lyrica, Neurontin, Cymbalta, or other medications for pain. Occasionally I will take nortriptyline for when I have really bad flares of pain. It's important for everyone to always consult your doctor regarding any pain medication and any interactions they may have with each other or any lifestyle changes. The morning is the best time of the day for me and for most with PNE, but as the day progresses, the pain also progressively gets worse. The more the nerve is irritated and compressed, the more it becomes inflamed and painful. It is hard for most of us with PNE to stand up all day or even half the day, but also at the same time impossible to sit for any length of time upright, meaning not leaning back, which I currently am in my lazy boy chair here, which takes the pressure off the perineum, and it's pretty soft and comfortable. But if I was sitting upright on a hard chair right now, I'd be in excruciating pain, and I wouldn't be able to sit for more than a few minutes. Same with driving; it's pretty hard. And the other option is to just lay flat in bed, which I would prefer not to do every day, all day. So, anyways, okay, getting back to what I was talking about. But around 12 o'clock or so, my pain has usually gone up to a 6 to 9 out of 10 on most days, especially when I have flares from doing certain activities previously. Even with the pain, meds, it still is this way. When it gets to that point, I usually take a warm bath to help relax the nerves in the pelvis and ease some of the pain. I sometimes take 3 or 4 warm baths a day to try to cope with the pain, especially during flares of pain from previous activities that cause a worsening of the symptoms. Every day I usually have no less than 1 or 2 baths a day. I never take a shower anymore as I used to be able to quickly do. For me, a bath is not just about getting clean, it is about managing pain. For many of us with PNE, life is very hard. Very few people understand what we face. Only those who have chronic daily nerve pain understand somewhat. Having chronic nerve pain daily in your genital area and not being able to sit with pain, sit without pain, to have sex, to run, ride a bike, or do most of life's normal daily activities without an increase in pain we already have is even hard to understand. Most of the exercises, hobbies, sports activities, and normal things we used to be able to do are no longer feasible. In order to maintain sanity and survive, we have to find new hobbies and activities we enjoy and are able to do without pain. Everything must be planned around PNE, unfortunately, and how I feel that day as well. It's hard for me to plan things that are a week or a month down the road. And going to Disney World with my kids is impossible for me now. I can walk, but not that long or far before my nerve starts to get irritated and painful from the walking. I certainly cannot ride on any of the rides because I cannot even sit without pain. I do occasionally drive if I have to for short distances. How do I do this? Well, I have a large Euro pillow that I sit on. I lean all the way back in the car, put my left foot up on the dashboard, and this is the only way. I may look funny doing this, but this is the only way I can have as less pressure on my perineum and pudendal nerve as possible. Even doing this, I end up flaring that day most of the time and having lots of pain afterwards. It's impossible to drive without any pressure on the pudendal nerve. When I was first told I had PNE years ago, I had no idea what it was or what I was in for it. I soon discovered it really hit home when my brother, a fabulous primary care doctor, and my father-in-law, a great, outstanding neurosurgeon, did not even know what pudendal neuralgia was, or even what or where the pudendal nerve was. Shocking to me, even though it is a major nerve and it is one of the largest nerves responsible for so many important sensory and motor functions in your body and pelvis. They were not the only doctors, however, who did not know these things, and they are both great and excellent doctors, much to their credit. Most of the medical community did not know these things either. I soon was flying all across the country to see the few handful of experts to see what my best options were. I was only able to really be examined by one PNE specialist, Dr. Ailey Dellin in Baltimore, for one opinion on what exact branches of the nerves were affected and what treatment I needed. Because of the long distance and dwindling finances, I was unable to fly back to see him. I was, however, fortunate to also get the best MRI in the country at this time, also from Dr. Hollis Potter in NYC, New York City, which did show varices bilaterally from the dorsal branch to the distal Alcock's canal, and it did help to confirm the surgical approach I strongly feel I need, which only 2 surgeons in the world offer. Unfortunately, the high cost of this surgery is out of not only my reach, but many others with PNE at this time. I hit another roadblock very quickly, though, in my path to finding the correct solution and to try and get a second opinion. I had an appointment with another one of the leading PNE experts who had a long waiting list, who always has a long waiting list, so it takes a long time to get in to see him, Dr. Michael Hibner. But then 2 additional new and unforeseen medical conditions hit me at one time last year, and it forced me to cancel my appointment. I got over those other illnesses in a couple months and rescheduled it. And then my appointment was actually canceled by their office, so I rescheduled it again. A couple months later, it was canceled again by them because of scheduling problems they were having. You can imagine my frustration. I can't be too mad or blame them, though, because I do understand that the number of patients with this condition outweighs the number of experts on this by an absorbent amount. This doctor, being one of the few specialists on PNE, has also done a lot of research and put a lot of effort in to try to help those with PNE, which is a lot considering the thousands of doctors in this world who aren't doing much, if anything, in the world. There's bound to be a long wait time and appointment cancellations or rescheduling with this. By this time, my finances had also gone drastically down to the point I could no longer afford to even fly to see another expert in PNE anymore or get surgery for this, which is expensive. Recently, about a few days ago, my own sweet 7-year-old daughter, she told me in her loving, thoughtful words that she could sell lemonade at a lemonade stand to raise the money for my surgery. She said she could charge $5 for it. My heart on the inside melted, cried, and laughed at the same time when she told me this. I love her, and she keeps me going and fighting this. I was no longer able to pay my medical bills or any other outstanding debt, and my business income had gone down. For my family's sake, I started to focus even more on working many hours, 80 to 100 hours per week, on my home business for at least a few months to try to pull us out of the rut we were in, despite the significant pain and symptoms I endured the entire time. I was also forced to be able to help others, to not be able to help others with PNE on a support group I was on because of how much time I put into trying to turn my business and finances around. After all my hard work, things had become barely stable financially, which meant we were not living on the streets. I went over and over my personal and business budget countless times, trying to see where any cuts could be made to help. So after brainstorming and thinking of everything I could possibly do to work from home, lying back in a chair most of the time to provide a living for me and my family, I realized that I had pretty much done everything I could, and then I just trusted God that somehow everything would be okay. The whole time I've had PNE, I've been thinking, how long will this pain and PNE continue? I once had a back nerve injury years ago, and it got better much quicker and was nowhere near as painful or debilitating as this is. I just kept praying and kept staying positive and kept repeating words I say to most people on support groups: there's always hope. One of the best urologists in North Carolina, Dr. Robert Evans of Wake Forest Baptist Medical Center, who's a member of the International Pelvic Pain Society and believes in PNE and treats people with it non-surgically, told me this. He told me this phrase one time soon after I got PNE: there's always hope, and it just stuck with me and kept me going along with my faith in God. Because the surgery success rate for PNE is so low and few are cured of this after a period of time has passed, the ones who still have it are kind of like pioneers in this journey. They have been to most of the specialists, had a surgery or two or three, had physical therapy, had many tests, and had many experimental or new types of treatment. These people have chosen not to simply accept PNE and deal with it and move on. They have chosen to accept it, but not to give up on finding the best treatment to resolve their symptoms. The answer to the question of what is the correct treatment for PNE is out there. We just have to find it. That is what drives those and myself who continue to talk with different specialists, surgeons, and doctors about their condition. The thing about PNE is that it's very complex for most doctors in this current time as far as how best to treat it or even evaluate it. There are a variety of ways that a person can get PNE, such as weightlifting, hysterectomy, infection, fall, injury, childbirth, surgery, or other trauma in the pelvic region. Some people get it from SIJD, peripheral syndrome. Others may have scar tissue compressing a branch of the pudendal nerve. The tough part about this is that even the best MRI, which is Dr. Hollis Potter's, can not always visualize scar tissue or the tiny nerve branches in the pelvis. The technology is simply not as good as it needs to be. A pudendal nerve block test is one of the best current tests to confirm pudendal neuralgia, along with the symptoms and other tests to rule out different things. But some have complained about getting worse because the needle nicked the nerve. However, most who get CT-guided pudendal nerve blocks do not get this problem, and there's a small percentage who have complained about this, so I wanted to just mention it. For those of you who are still watching this long video, just be glad that you don't have PNE if you are for some reason bored. At least you can sit down normally without any pain. Everyone else with PNE watching now who is maybe bored must right now be laying all the way back down in bed or standing up during it or leaning back on their lazy boy chair. Another important thing I wanted to mention, there are many who used to be the sole providers for their family who are no longer able to do this and must go on disability and live on peanuts or with family members. In these situations, there must be a role reversal where the father, who used to be the sole income provider, must now stay at home to take care of the kids, and the mother must be the sole income provider. For those where the mother was the sole provider for the family, the father must now be the one to go get a job to become the sole provider for the family. There are also others with kids who are in marriages where both partners have a good job to bring in income, but the loss of work from the one spouse seriously still affects the whole family's financial situation. The reason that most with PNE have to go on disability is because it is impossible to do almost any job with this condition. The most important and sad fact is that some family members, I've heard this many times from people in support groups, some family members, however, of those with PNE, do not take their family members' medical condition very seriously at all. They do not understand how much pain that they are in. They do not eagerly want to or seek to try to research or try to get their own family members the necessary evaluation, treatment, see specialists, or get the surgery they may need by any means necessary of their own. I really do not understand this. I know of many patients with PNE with this problem. I know of patients who have family members who are millionaires or are very rich and able to afford many luxurious things, vacations, cars, but who choose not to help their own family members with this. Many patients with PNE have already used their health insurance to see many doctors and to eventually get diagnosed, only to be stopped in their tracks of getting further opinions and treatment or surgery from the few specialists in the world because the inevitable physical and financial toll the medical condition has taken on them. There are several things that come to mind as to why this may be, why other close or distant relatives choose to not take their family members' pain or condition seriously. I think that it is very difficult for anybody else to truly understand the amount of physical pain along with the symptoms that patients with PNE experience unless they have it themselves. This is especially true for those who have had PNE longer. Patients with PNE cannot just simply say every hour of every day that they are in pain, even if they are so. So those around them just assume they are not in pain or not in a lot of pain, which is false. The sad fact is that if you truly have PNE, you are in pain for most of the day, with the evening being the worst time. It's time for family members to acknowledge this and to face it, and to try to imagine a horrific pain in the genital pelvic area, somehow imagine it, having it themselves, and somehow imagining feeling it, even though I know it's hard to do. But if you can just maybe imagine that on a, maybe on a scale of 5 to a 10 out of 10 pain level, maybe you'd understand. I hope to make a difference for those with PNE both now and in the future. I strongly believe that real change is brought by awareness and research. Dr. Martin Luther King Jr. is a great example of this. He did everything he could to bring awareness to the evil of racism and was able to help bring change to America and end racist practices and laws. We, as patients, friends, family members of PNE, or doctors willing to help those with PNE, must do everything we can to bring awareness to the public and to the entire medical community in the world to bring change and improvements to treating PNE. We must bring awareness to the American Medical Association, American Urological Association, Obstetrics and Gynecological Association, the American Neurological Association, International Pelvic Pain Society, Peripheral Nerve Associations, plastic surgeons, and every medical school in the country that we can to bring change. I've started an e-petition that you can easily sign in 1 minute requesting research, training, and awareness for all of these conditions, for all of these doctors and associations. And I hope to have as many people sign this as possible before sending it to these associations and doctors and schools. Please help us and take 1 minute to sign it at this link. We are eternally, forever grateful for those who sign this petition and to all the doctors who currently help us with PNE and for those who decide to take up our cause to try to help us. You're not just helping us, but the thousands of those in the future who will also be diagnosed with pudendal neuralgia or PNE. Please feel free to read the ebook I wrote for only 99 cents regarding chronic pelvic pain from pudendal neuralgia, PNE. You can download it and read it on your computer or download it to your Amazon Kindle or Barnes & Noble book. All the proceeds for this book go to nonprofit organizations to help those with PNE. You find it on the following 2 links given below. Please also visit the following sites for more information and help with PNE. The first link is to my own YouTube channel, Pudendal Nerve, which features some videos that I posted and uploaded on PNE, and also some videos I favorited that are helpful to those with PNE. The second one is a valuable site for support, information, names of PNE specialists, and forms for patients. There is a link to on the homepage of the website to another website that sells Pudendal Neuralgia awareness bracelets. I'm actually wearing one of these right now. All the proceeds from this go to fighting PNE. Let's see, I'm not sure if you'll be able to see this, but it says Pudendal Neuralgia, Pudendal Neuralgia Hope. So, and on the opposite side, it has the website www.pudendalhope.org. The third site listed is similar to pudendalhope.org. It's also a support site for patients. The pelvic pain website is the site for the International Pelvic Pain Society and is a good resource for doctors and patients. Doctors can actually become members or attend the conferences they have each year where they discuss pelvic pain conditions, including PNE. The pelvic messenger sites have a very large following and are very good websites where Elizabeth and Jessica interview leading experts in treatment of many different pelvic pain conditions, including PNE, endometriosis, and more. The next one, Dellin.com, is Dr. Ailey Dellin's site, and you can download Chapter 12 regarding this pelvic pain publication for free there, and it has a lot of information on pelvic pain and PNE. He's also one of the few experts on it, and surgeons. The next one is Dr. Tibet's site, which talks about his laparoscopic approach to decompressing certain branches of the pudendal nerve. This method is less invasive than some other methods and is a relatively new method. The last one is a Facebook support group for those who suffer with PNE. After you go to the Facebook one, click on Ask to Join, and somebody will add you to our helpful support group. Bringing awareness to the medical community and to the word about PNE helps to bring change and more research in defining better evaluation methods and treatment, which is important. This is why I focus a lot of my own efforts on this. There are many things you or your own doctors can do to spread awareness to help bring change, such as number 1, writing a blog; 2, writing medical associations such as the American Urological Association, American Medical Association, American Neurological Association, med schools, Obstetrics and Gynecological Association, writing your previous doctors or calling them to let you know that you're finally diagnosed with PNE rather than whatever diagnosis they originally gave you. Educate all of your friends and family members about exactly what PNE is. Educate all of the doctors you can about PNE. You can write a book about your own experience with PNE. You can write or call news stations and newspapers to see if they would be willing to feature your story, or possibly other TV shows to see if they'll feature your story or discuss PNE. The last one you can do, I can think of, is just to think outside the box and do anything else that you can think of. There are many ways to bring awareness. You just got to brainstorm and think of them. I'm now going to read the e-petition, which we desperately need many signatures for. I'm hoping to get at least 1,000, but I am thinking it's possible to get at least 5,000. The link for this is at the following, http://www.ipetitions.com/petition4-more-research-on-and-training-for-all/ or you can see it on the screen. Here is the actual petition. Chronic pelvic pain can be caused by pudendal neuralgia. This is a factual statement backed by the internationally accepted diagnostic paper, the Nantes criteria, published in 2007. Yet, many people worldwide are still suffering unduly from this debilitating condition. Many are wrongly diagnosed and therefore remain in pain without hope or targeted treatment. Please think about this. Patients with bladder problems, urinary frequency, bowel dysfunction, and genital pain, men with erectile dysfunction, penile pain and prostatitis, women with endometriosis, dyspareunia, interstitial cystitis, and fibromyalgia, who have been unresponsive to treatments typical to these more universally diagnosed problems may have pudendal neuropathy. The pudendal nerve and its branches take a tortuous path through the pelvis and can be compromised at any point, just like any other peripheral nerve. However, many doctors are unaware that the condition exists, while other peripheral nerve entrapments such as carpal tunnel and tarsal tunnel syndromes are eminently accepted pathologies. Because of this medical neglect, PN patients find that it takes 1 to 15 years to get a correct diagnosis, with an average of 4 years. This is, of course, before any positive treatment can be prescribed and then undertaken. These unfortunate circumstances result in compounding medical and social difficulties for the sufferer, including depression, hopelessness, and an often huge personal financial burden, not to mention a severe drain on government budgets due to any subsequent benefit handouts. Misdiagnosis can also lead to wasteful, expensive treatments, unnecessary surgeries, and prolonged nerve trauma. Worryingly, the longer any nerve is compromised, the less likely a good outcome. One of the reasons pudendal neuralgia has been overlooked is the lack of a medical specialty and its exclusion from medical school curriculum. The pelvic area has a conflicting overlap of medical specialties because of its anatomical location. For instance, a neurosurgeon would not usually examine gynecologically, while a gynecologist would not always happily treat nerve problems. So the PNE patient falls neglected between many medical modalities, and a correct diagnosis remains elusive. Thankfully, some neurosurgeons, urologists, hip surgeons, gynecologists, pain consultants, and plastic surgeons have taken a personal interest in the problem and attempt to alleviate the patient's suffering. Currently, there is no standard of care for patients with pudendal neuralgia. Patients typically must become their own advocate and often travel exceptional distances to find a diagnosis and hopefully treatment, resulting in further financial constraints. Treatments, however, can be as simple as pelvic physical therapy with a knowledgeable PNE-aware practitioner, although those resistant to conventional treatments may require decompression surgery. The enigma is, as recently reported, PN can be easily diagnosed at the following site, www.peroneology.com/files/ICS-Glasgow-diagnosis.pdf, which you can see on the screen. We, the undersigned, ask that more attention and research be given to pelvic nerve entrapments, including the pudendal nerve, which affects many vital sensory and motor functions in the pelvis. We especially request that peripheral nerve surgeons in America and worldwide sense the urgent problem that pudendal nerve entrapment entails and develop appropriate and timely diagnostic testing and treatment. We implore all medical schools and medical associations to communicate this problem of pudendal neuralgia to every student. It deserves their attention and yours. We also ask that you try to bring as much general awareness to this condition as possible through medical conferences, meetings, speeches, and publications. Although pudendal means shame, we are not ashamed to spread the word and hope you will help us. There are only a mere handful of surgeons in the world who are offering treatment and surgical decompression of the pudendal nerve and its branches. We thank them all for the compassion they have shown in their research into PN, which has been beyond their own varied specialties but has proven so necessary. The majority of patients suffer silently and terribly with an extremely poor quality of life because of the sexual, physical, financial, and social limitation that this disease causes. On behalf of all PNE sufferers, we are eternally grateful for your help. Thank you so much. That's the end of the petition that was created. Please sign it. The million-dollar question to me is, what is the best overall diagnostic, evaluation, and treatment for the complexity of the pudendal nerve and for all pelvic nerve neuropathies. So far, I don't think we have achieved either one of these, but we will. Another frustrating thing is that people should be able to go somewhere, at least in their own state, to get the best evaluation and treatment for this without having to see numerous doctors, websites, etc. A primary care doctor, urologist, gynecologist, neurologist should be able to have somebody in the state, each state, that can evaluate and treat you for all pelvic neuropathies. They should also know who to refer you to for pelvic neuropathies and when to do it. Also, in this day and age, why in the world is there not a specialist for peripheral nerves or more of them? There should be a specialty for doctors to become a peripheral nerve specialist or a peripheral nerve surgeon. There are neurosurgeons and plastic surgeons, but they don't all deal with all of the different peripheral nerves in the body. So why is there not a specialty for a peripheral nerve specialist or peripheral nerve surgeon who does deal with all the different peripheral nerves in the body and decompressing them and treating them? The medical community really needs, in my opinion, to improve in all these areas, and I believe that research and awareness may be the catalyst needed to help achieve all of this much sooner rather than later. I'm now going to finally conclude this video, which I hope has helped everyone with PNE and the public and doctors and everyone worldwide, with the poem that I wrote for everyone with PNE. My healing is coming and near, praying the same for everyone with PNE who I hold dear. Things are going to change soon. I can feel it and hear a happy tune. Everyone in the world will soon know what PNE is, and change will rapidly flow. I'm going to do whatever in the world it takes. It's time pelvic pain is cured, for goodness sakes. Nothing can keep me down, not even PNE. Gonna tell the world so maybe they will finally see. Gonna get people the treatment they deserve. Not that hard to decompress the right nerve. We need actions and our voices to be heard. Gonna write a book, make videos, and a petition. I will do what it takes for people to listen. Hope everyone else here will do the same. Time to get serious, because PNE is not a game. Alone we can do something and help fight. United we can do more and end this plight. Fight PNE, fight PNE. It's not up to me. It's up to you and you and you and me. All of us together fighting for each other, fighting for our family and for one another. If we try and fail, then at least we tried. If we fail to try, then we lost more than pride. We lost our freedom, soul, and self-respect. If we do something, then we'll never regret. PNE may give us pain and lots of rain. PNE may drive us crazy and insane, but not without a fight. Well, will I let it come and take away yours or my own freedom? Fight PNE.